right, and we're here for another episode of the Lowdown, which is the clever name of this podcast. Today we have a special guest, Dr. Greg Wells, who is a Ph.D. in Performance Physiology. He was actually one of my professors during my undergrad at U of T, so it's sort of nice to come full circle and have the chance to speak to you today. Obviously, with all of the crazy things going on in the world, right now, I know part of your PhD was in respiratory physiology. So, I mean, COVID being mainly seems to be a respiratory virus. I know there's some scientific evidence suggesting that it may actually affect other systems in the body, but primarily a respiratory pathogen. I thought it'd be interesting to speak to someone with your knowledge. But before we get started, I'll sort of give a quick background on you to the listeners. I'll probably do a horrible job at it, and then I'll throw it to you to sort of refine it. So if I remember all this stuff correctly, you did your PhD in respiratory physiology. I believe you went on and did a postdoctoral fellowship also in respiratory medicine, and I think that was through Sick Kids. Okay, my memory's pretty good. You're also a best-selling author. I guess the most popular book is The Ripple Effect, and you have a few other ones, so maybe you could tell us about those in a second. And mainly you're focused, I guess, overall on overall human performance. Is that a fair sort of summary? And please add anything that you think is relevant.
Sure. So, the 90-second history.
Yeah.
Crazy. You can do that for your entire life. You summarize your entire life in 90 seconds, but here we go. Competitive swimmer growing up, broke my neck when I was 15, sparked my interest in the human body, came back to being a competitive swimmer after breaking my neck, swam through university when I did my kinesiology degree. After that, launched a consulting company, did that for a few years, then went back, did a master's in exercise science, PhD in respiratory physiology, postdoc at Sick Kids in respiratory medicine and cystic fibrosis, and some cancer work as well. That then led me to Toronto General, where I did another postdoc in biomedical engineering, ironically building respirators.
Wow.
Which has become
I guess that'll
kind of obviously important these days. The company I worked for actually just out of Toronto General just got hired to do a whole bunch of work to use the respirator that we tested for a whole bunch of things these days. And then have gone on to be a professor at the university, retired from that about a year ago. I'm still scientist at Sick Kids and in translational medicine, doing a lot of public speaking, a lot of writing, doing a lot of corporate consulting these days as well. So sort of, and through all that time, worked with the Olympic team, coached or was a physiologist for almost 200 Olympic athletes. So have that as well. So lots of things going on and just trying to adapt to this crazy new world that we're in at the moment in this COVID time. So it's been a wild ride.
Well, yeah, and I mean, that's a great 90-second history, and you've clearly done a lot of things. There's so many questions now that I have, even knowing some of the other things, but sort of one thing that you said there was working with building ventilators and things like that. Can you tell us a little bit about that experience and sort of, I mean, for the average listener, what exactly a ventilator does, sort of when it's needed outside of, everyone thinks that this is a new thing for COVID, but it's not. These are at all hospitals and they're important for emergency medicine.
Got it. Yeah. So I worked with a company called Thornhill Research, which was started by Dr. Joseph Fisher, who is an anesthesiologist at Toronto General. So I did my postdoc at Toronto General with Joe. And we ended up working on this respirator design, amongst a bunch of other things. We did gas masks and a whole bunch of other physiological testing. But one of the big projects that I did was the testing on a ventilator that we were building. And the idea was that when you are moving a patient throughout the hospital and other places, you're moving patients, there's a lot of equipment that goes with it. There's a ventilator, which is attached to a tube that goes down through your trachea and basically inflates your lungs to keep you breathing when you otherwise wouldn't be able to do that yourself. So you have to control the pressure, you have to control the volume, you have to control the flow so you can control the ventilation, how much air actually moves in and out of the lungs. At the same time, you need to monitor all their physiology. So you need to know what their oxygen saturation is. You need to know their carbon dioxide levels. You need to know their heart rates. There's a lot of physiological monitoring that we built into the system. I should say that the biomedical engineering team built into the system that I was testing. Dr. Fisher also worked on creating the capacity for the system that we were building to manage anesthetics, which was really, really interesting. So we took all of this equipment, which is normally about 300 pounds per patient. Wow. And this equipment is used to move someone from an operating room to the ICU or whatever. Also for soldiers on battlefields, taking them from a place where they're injured back to a field hospital with oxygen tanks. You can imagine that that's not a great thing to have on a battlefield. So we took all of that and brought it down into about an 80-pound piece of equipment that you can just clip on the side of a stretcher, and it's a full self-contained life support system, which is obviously incredibly valuable in this COVID time when we're short of respirators. And so Dr. Fisher's company and all of his work at Toronto General and with Thornhill Research has exploded literally in the last 6 months. I haven't been there for many, many years, but it's super cool to see, you know, all that work that we did many years ago finally being used to really help a lot of people in this crazy time. So you never know what you're going to do, and you never know what you do, the impact that it's going to have. It might be years later. So it's been pretty wild to see all of this play out.
Yeah, and especially involved in taking something that's so robust and so complicated and making it and that's sort of like you said, I mean, you wouldn't have known at the time, but to make it into such a more efficient and useful tool, not necessarily useful, but more efficient in terms of sizing and things like that, I guess helps tremendously during this time where ventilators potentially, I mean, I think a lot of the research coming out, especially here in Ontario, is that we're probably not gonna, it doesn't look like right now anyways, we'll be exceeding capacity, but definitely scary when you look at other places around the world to know that that's a big thing, right? When someone was bad enough to go on a ventilator. I wonder if you have an opinion. Some of the statistics I've seen is by the time someone had to get put on a ventilator anyways with COVID, their chances of survival weren't good after that anyways. And I forget the exact numbers, but it was almost like a coin toss, right? A 50-50 type of chance. Any comments on that? Any thoughts, any research that you've seen? Anything?
Brilliant, really good question. I have not seen the data on survival rates for COVID patients when they go on ventilators. I don't know. I would just like what I do understand about the pathophysiology of the disease. And to be clear, I have a Ph.D. in exercise physiology. I'm not a respiratory I do not have a medical degree. So this is Greg sort of explaining respiratory physiology and being super clear about my scope of practice. So I understand that COVID-19 gets into the respiratory system, attacks cells on the lining of the respiratory tract, damages those cells. They then become incapable of moving. So our respiratory system is lined with cilia, which are little tiny hairs which clean out the lungs and keep us able to have a thin film of fluid through which gases pass to go in and out of our blood. And so COVID-19 breaks down a lot of those tissues and damages those cells, which means that fluid builds up and we're unable to move gases through those membranes to get gas from the environment into our blood in the case of oxygen, and CO2 out of our blood in the case of carbon dioxide. And so as that damage accumulates and our inability to move gases is increased and those fluids build up, making it really hard for people to breathe. There was a point when some people may need assistance from a respirator to make that happen. Obviously, if you progress to that point of needing a respirator, the disease is extremely severe. And so I don't know the exact survival numbers of related to COVID patients who have been put on respirators versus, and so I don't know, but that is what's happening, and it's certainly interesting to track. And you know, all we can do is really hope that we manage this situation well enough so that we avoid the need to put people on respirators, and we have enough respirators for everyone. And so far, it appears that we're doing that in certain locations around the world, not all. But hopefully that we can, you know, keep this pandemic, within the limits of what our medical system can handle.
Yeah, for sure. And I think that's an important point. With, again, I know you prefaced it by saying that you have a PhD and you're not a medical doctor, but yet that's still an incredible amount of knowledge. In terms of the physiology, just because I think it's a little bit interesting, one of the things that I guess most people don't realize is that when COVID gets bad enough in that process where it leads to ARDS, which is acute respiratory distress syndrome, that can happen as a result of a lot of things. Even flu can lead to that. It's really that is the problem. Can you walk us through a little bit about ARDS in terms of the physiology in a sort of digestible way for the average listener?
So again, I'll just keep it super high level and make sure that I'm just keeping things at a very broad scope. So I think the easiest way to think of this when it comes to the respiratory system is that quite often people think of their lungs as, two big bags of air. And the reality is that your lungs are sort of much more like sponges. There's lots of different tissue in there, and there's many different little tiny bubbles. They're called alveoli. If you were to take your lungs and sort of spread them all out on the ground, your lung tissue would cover a tennis court. There's lots of tissue in your lungs. The reason for all of that tissue is you need surface area to transport gases across that tissue. And the gas transport happens better if there's a little tiny layer of fluid called surfactant, which lines all of those alveoli, the little bubbles inside of our lungs. And ideally that layer of fluid is extremely thin, like microscopically thin. And the cells that your alveoli are literally only one cell thick. So there's blood, one cell, a little bit of fluid, and then air. And that transmission of gases happens across that pathway. So anytime that we have pathology inside the lungs, and I've spent a lot of time in my career working on a disease called cystic fibrosis, where lung tissue becomes broken down due to infection and scarred. I've also done some work in primary ciliary dyskinesia, where the cilia inside of our respiratory tracts doesn't work, so we get infections and damage to lung tissue. And so when there are problems with cilia moving invaders or particles or bacteria up and out of the system, that causes problems. When we have cystic fibrosis and there's mucus buildup, and that mucus becomes infected, that scars the tissue, then the lungs can't expand and contract very well, and lung tissue becomes damaged. That's problematic. Pneumonia is a situation where fluid builds up. And the problem there is that as that fluid builds up, it's harder for gases to move across those membranes, which makes it very difficult for us to ventilate properly and to get oxygen into our blood and CO2 out. SARS and MERS, other respiratory conditions, create all sorts of problems in the respiratory system, as does COVID-19, and the flu. So it's definitely something, it's a very important system that we sometimes take for granted. But obviously we know that we need to breathe to live, but breathing is incredibly complicated. The lungs are incredibly complicated, and ventilation is incredibly complicated. And so it's definitely something that we're learning a lot about. And, I'm sort of digging back into my basic respiratory physiology to understand it a little bit better. And I'm not a frontline worker, but I'm interested just from an awareness perspective of what's going on. Hope that helps.
Yeah, no, it does. And I think even just sort of on a high level, making someone understand that you're right. The average person will think of the lungs as these two big bags that are just, air's going in and out, but really understanding the surface area. And I mean, the GI tract is very similar in that sense too, where there's a tremendous amount of surface area, and our body is sort of designed like that because of how many things have to cross over between an external environment and an internal environment, which is, I think that's a really good way to put it for the average person, to make them understand that it's really not that simple. There's a lot of complicated things. And I don't know if you know anything about this next question, but one of the things that I've seen is also that outside of the respiratory types of symptoms, so even with COVID, there's some people that are not necessarily having any type of respiratory distress, but they're still becoming hypoxic, which means their O2 levels in their blood are still low. Do you know anything about that? Is that also related to it being to do with that transfer of gases at the lung? They're just not symptomatic enough to realize. Is there any insight that you could provide on that?
So I've seen that data as well. I'm not confident in that data, to be completely honest.
Yeah.
And the reason why I'm not super confident about it is that I'm just not super confident in the data. But if I was to say that people are becoming hypoxic, which means that their O2 levels are low, which means that gas transfer is not happening, there's a couple things that could be contributing to that. And again, this is just like basic respiratory physiology. I'm not saying this is exactly what's happening in COVID-19. But from a basic physiology perspective, that
we
means
have a disclaimer at the beginning of every podcast.
Okay, cool. This is not medical advice.
Yeah.
I'm not talking about COVID. I'm talking about general respiratory physiology. So if your ventilation decreases, if you're not getting enough air in and out of the lungs, basically you're not breathing enough, and that includes sort of volume, how big your lungs get, or frequency, how fast you're breathing. Both of those contribute to air moving in and out of your lungs. If you're not ventilating enough, tidal volumes not big enough, breathing frequency is not big enough, you will not get enough gas exchange in and out of your lungs. And as a result, your O2 levels will drop and CO2 levels will go up and you will get hypoxic. The other thing that can happen is that in the case like pneumonia, for example, fluid could build up inside the lungs, making it difficult for us to get gas out of the air and into your blood, even if you are ventilating enough to keep that gas exchange happening, but the transfer may be affected. Then there's other conditions like sickle cell anemia would be a good one, for example, where red blood cells are damaged and the oxygen can't carry blood. Right. And so it could be any one of those three things that's going on. When we see people who are hypoxic, it can be the fact that ventilation is not good. It could be the gas transmission across the membrane is not acceptable, is not working properly, or it could be a problem in the blood itself. It could even be further downstream from that in the actual tissues, the muscles, or whatever else. So those are the three steps of where a problem could be happening. And I think that it's too early for us to know definitively whether where that particular situation's happening in people who are hypoxic with COVID-19. So I will not talk about COVID-19. That's just the three places where there could be a problem there. And it's worth considering as you read some of that information that's coming out. And I also think it's important for us to know that there's been a lot of misinformation out there. So it's important for us to be very careful about where we are getting our medical interpretations from when it comes to COVID-19. So I've seen even some medical professionals putting out information that is not, in my opinion, accurate and is not a good reflection of what's actually going on. So I've been relying on CDC. I've been relying upon World Health Organization. Not that they're perfect, but certainly I've been trying to rely upon the people that are actually doing the real research and the true experts in infectious diseases and respiratory medicine professionals that I trust. So it's important to be careful with where you're getting your information from right now. Not saying that what you were was wrong. I just don't. It's just let's all be really careful.
I'm sort of part of me going through this exercise is also to pick other people's brains in terms of what they've seen. There's a lot of stuff that I've seen too. I mean, the other reality about this thing is it's called novel for a reason. It's new. So totally. what we knew to be true a month ago may totally end up being wrong today. That doesn't necessarily mean that a month ago someone was lying or doing something malicious. It just means that, as we get more research, we find out new things. And there's sort of the word unprecedented gets thrown a lot right now, but there is sort of a lot of unprecedented amount of research that's coming out. I mean, one of the big concerns with that is a lot of it's not peer reviewed. And so you're just sort of being presented something that hasn't gone through the process. And so, as a clinician or as someone interested in the science, you're looking at it. And I guess your point is very valid. It all has to be taken with a grain of salt until better research is available for that overall.
Yeah, and I think that you bring up a really good question, and it's important for us to understand this as science overall. I mean, science has taken a bit of a beating in the public media, and in social media over the last little while, and that's whether you're talking about climate change or whatever science has taken a beating, and it has in this case, in this situation as well. So we need to understand that when we do research, it's called research for reason. And you're redoing the search over and over and over again. It's iterative. It's not definitive. We learn, we publish, we test, we continue to learn, and it will evolve. And so that is how we learn. It's the best system that we have available to us as humans to learn, to ensure that what we are learning is of the highest quality that it can be. It's not saying that the scientific method is perfect, but it is the best that we have. Even when you think about something as modeling, when we're doing predictive models, we are analyzing the data that we have to predict what could happen in the future. That may not be exactly what happens, and the model iteratively changes as we get more data, and we can be more and more and more accurate. So we're in the middle of that right now, and we're seeing the entire planet stop all research on anything other than COVID-19. The pace of production of data is accelerating as it should, and we're lucky to do so. But and your final point that you made about peer reviewed is really important. We're seeing a lot of data before peer review, and that's important. We got to get it out there. We got to learn fast. But always be careful about, what journals are they publishing in? Where are you reading this from? Do a little bit of digging to find out what the source is. And that'll give you a little bit of an insight about whether or not the data that you're reading is credible or not, and whether you can trust it to start making decisions for you and your family.
Yeah, and I think it's funny, and this is a bit of a tangent, but I think as a scientist yourself, you'd appreciate this even more. the term research is something that gets thrown around all the time. Like you hear the average person, you talk to somebody and they say, well, I researched that. And you say, well, what do you mean you researched that? And they say, well, you know, I went on Google and I looked at the first three things. And it's like, but that's not research, right? That is not the scientific method. And so it's one of those terms that everybody sort of wants to say, well, I've done my research on that. And they're not really understanding what proper research is. You know, you may have read a book and that book had an opinion, but that doesn't necessarily mean you've done research. You may have started to investigate and sort of started to build your knowledge, but you definitely didn't do research, right? And part of when I teach at the chiropractic college and in clinical education, and I teach students to go look at and this was a lot of what we did at U of T, even in your classes, is being critical of research, right? Not just looking at something, but so many things like understanding who's paying for this research, where's it coming out of, what are the sample sizes, what type of study is it, all of these things matter. And so it's always interesting, and I find it, and again, I think as a scientist, you probably appreciate that people think a case study like what their uncle did is research because it worked for their uncle, but they're not appreciating that there's a scientific method where you want to be able to reproduce those results over and over again in some type of a controlled setting. That way we truly genuinely know what the real answer is, whether it supports your hypothesis or it doesn't. That should be irrespective of the objective anyways.
Yeah, and what you're saying can probably be really overwhelming for people.
Yeah.
Because they're like, what the heck do I trust? Like, I don't have time to go and do hours of research and all this stuff. So, and I very clearly remember a moment during my doctoral training when I did something called a comprehensive exam. So you do your coursework, then you do a comprehensive, then you propose your research and you go on and do your research. In the comps, I answered some questions and I answered them based on what I thought, and some of them were my opinions.
Right.
And I got absolutely destroyed by a couple of the people on the committee who just tore me to pieces. And then I realized that I actually knew nothing.
Right.
And it's only once you realize, even after like 4-year undergrad, 2 years of a master's, 2 years of a PhD, so I'm 8 years into university at this point. I only realized in that flash, as I, did not do well in my first comps. I did them twice, did better on the second round, which means I failed the first round in case I didn't do that one out. What I discovered in that moment,
I always thought so much higher of you until now.
Yeah, well, I've failed more than anyone else I know, actually.
Well, that's where you learn, I think, right? That's probably part of your success. That's probably true. Yeah.
So once you realize you in fact know nothing, then you can start to learn.
Yeah.
So if you go in with opinions, then you're going to be in trouble. If you go in unwilling to maybe have your hypothesis disproven, you're going to be in trouble. And so all of us right now, citizen sort of journalists, as we're reading all of the stuff that we access on the internet, we have access to the entire history of all human knowledge in our pockets, in these phones at all times, which is great. It's democratized information. I'm a big fan. You need to find the people that you can trust to distill this information for you. And so that would be world-class medical professionals who can actually translate knowledge in such a way that it's understandable. We need to be really careful about who we are getting our information from, what the sources are, who's paying for it. And then if you want to dig deeper, you can go and find the actual sources, read the journal articles, start building the spreadsheets, start putting it all together and seeing how it fits, because one research paper is just part of a massive puzzle. Yeah. And once you get a grasp of the entire puzzle, you can start to see trends, and you can start to see in general things work like this, but there's some outliers that might work sometimes, not all the time. And that's where you can get some really deep understanding about a topic that you particularly love and are interested in. And for me, that's, I love the respiratory system. I always have. I'm super interested in athletic performance. That's another area that I sort of dig into, but still, there's more to learn there. I've been at this for 25, 30 years almost now, and I'm still learning every single day, seeing new things like, oh man, that's cool. That fills in this gap that I didn't know about. Right. So I think the end message is that we just want everyone listening to this show just to become lifelong learners, ask good questions, be open, be non-judgmental, contemplate the fact that, you know what, you might be wrong. Let's keep learning. Let's keep testing. Let's keep finding out what's going on, find good people, support them, ask them questions, and that'll help them learn too. And then all of us move forwards together.
Yeah. And I think that's a point that a lot of people with any type of, post-secondary education a lot of what I remember about you, like, I don't remember a lot of things from undergrad university for sure, right? It was a long time ago, but I do remember that what it really taught me was not necessarily to memorize something, but really to be a critical thinker. And when you can be a critical thinker, as you're saying, then that really is, and that's the process. That's the lifelong process, really, that we're all aiming for, is that ability to be critical of things and sort of look at that. That's why, even in this situation where we find ourselves, I think that's why credible sources are so important to rely on, right? And even they may get it wrong, not because of, again, malicious intent, but probably just because things are evolving. But at the very least, they're going to be doing their due diligence to report back what they believe to be the most accurate facts at the time to the public.
I hope so. And again, we're looking for like credible sources, right? But I think that your point is it that you mentioned is, we'll go back to university, and you said, like, I don't remember much. I learned that memorization, and I don't remember anything from undergrad, but it's probably better. So like, you're like, I don't memorize anything, but I learned to think critically. So contemplate the shift that's happening in the world, and has been for a long time, where we have the entire history of all human knowledge in our pockets at all times. So memorization is essentially become useless. It is no longer of any value, because you have access to it all right here, if you know where to look. Then what matters is, how quickly can you take that information in? Can you critically analyze it to see if it makes sense? Can check it to make sure that it's valid, and then use that information, right? Our entire what used to be important, memorization and regurgitation, is no longer of any use. Especially, this will become more and more important as artificial intelligence comes online. So this is a really important discussion for anyone listening. It's like, how do I make sure that I'm successful in the future? How do I make sure that my kids have jobs? How do I make sure that I'm going to be agile and can continue to have a career for the next 10, 15, 20 years? If you're retiring in the next 3 years, don't worry about a thing that we're saying. You're all good. Just enjoy yourself and make your cash and go to a beach.
Yeah.
But for everybody else, it's got to keep working for a little while. Like, this is important.
Yeah.
Our ability to learn and synthesize information and to test it to find out if it's true or not is, I think, one of the most fundamental skills that we all need to be having now more than ever. And it will become even more important even after this whole COVID-19 thing is over.
Yeah, absolutely. I'm sort of, it's funny, I'm working on my MBA now, and I just finished a leadership class, and a lot of what we were doing in that are things that sort of apply, because a lot of these things you can sort of hone in on one area of life, but you can extract them to others. And you mentioned a couple things there in terms of agile. Like, one of the different types of leadership is agile leadership, where you're looking really to move teams around and figure out how things work best and let people naturally go in different areas. And then there's adaptive leadership, which is another form, which obviously right now, adaptation is key for anybody, right? Looking to really survive and go on to the next thing, because the world may potentially be different forever after this, right? So we will, I think that, you're either going to adapt or you're not going to adapt. And if you don't adapt, there's some big problems potentially coming for potentially you as an individual, your business, whatever it may be. But adaptation is a really key thing. And it's interesting that in these bodies of knowledge, and the only reason why I bring up the MBA is a lot of the same underlying themes are extracted to sort of everywhere in life, right? Like, if you apply these types of things, and part of my interest in wanting to speak to you as well as a performance physiologist is, one of the things that I've been speaking about a lot to the audience is, I think another thing that COVID-19 is sort of bringing to light, when you look at serious illness, and that a lot of the serious illness is really related to comorbidities that are potentially a result of a lot of lifestyle things, like obesity, like hypertension, all of these things where, I mean, you and I come from the U of T world of phys ed and kinesiology, where that's all we ever talked about was be active and eat a moderate diet. And that will be better for your overall health. Overall, doesn't matter what it is. And that's one of the things that I've reiterated. Like, when I've been doing the radio show, which is live with callers, and people are calling about, well, I've heard that people that smoke cigarettes have a worse outcome with this. It's like, duh, like, they would have a worse outcome with that, with anything almost anyways.
Right.
It's just not a healthy lifestyle thing, right? And so even people like this, I hope this is some type of, I want to use the word of an awakening, but something where it really motivates people to understand, like, we're not always going to be ready for the next health challenge in terms of having a vaccine or a treatment. But one thing that we can all be ready for in any different way is take care of your bodies, take care of who you are as a person. And I mean, your book, a lot of it is about that, right? The ripple effect is really about how you get these different areas of your life in check in order to really do that. So that was that was one of the things that I really wanted to pick your brain about and see what you thought about that.
Yeah, I love that thinking. So, I mean, we do know that when you are healthier in general, when you're generally healthy, general health,
yeah,
physically fit, mentally healthy, right? All these sorts of things. You're going to have a greater resistance to, or a decreased likelihood of having a chronic illness like cancer, heart disease, type 2 diabetes, metabolic syndrome, depression, Alzheimer's. Not to say that you are guaranteed not to get them. There are genetic components and just bad luck sometimes. Like, this is going to happen, but you reduce your overall risk. Similarly, we know that general health status, physical fitness, those sorts of things, stress levels have an effect upon our immune system. And our immune system is how we fight off invaders like colds and the flus and COVID-19. So all of this plays a role in our overall health, our overall immune status, and our ability to stay healthy when confronted by either a disease that we acquire because of genetic errors or environmental conditions, or an infectious disease. So clearly this is all in play. And so the nice thing about it is that we can control that to some extent. We can allow ourselves to be healthy. We can eat the healthy meals. We can go for the walk. You can get your sleep. You can practice meditation. You can spend time with family. Once this is all over, you can get back out and go to a park and sit there and inhale some fresh air. Yeah. Which you can do right now, by the way. Like, we're outside every single day, my family and I, right? Yeah. We're not physically close to anybody, but we're wearing our masks and getting out in nature. And I think that idea that we can control our health is in our control, is a powerful one. And I think that now I'm seeing in some of the work that we're doing and the speaking that we're doing and the programs we create online and stuff like that, that there's never been a time ever in the last 15 years, 20 years, where I've seen people so ready to learn about healthy eating, to give themselves permission to sleep. Now that we're not exercising in our gyms every day, people are freaking out. Like, I need to work out. Like, yes, we do. Let's do the online yoga classes. Let's do the boot camps in our living room. Let's go for the walks. I did, a bunch of squats the other day with my 5-year-old on my back. Judith, my wife, is doing walking lunges with Ingrid, who's 90 pounds. Like, there's ways of doing stuff. We just got to be creative. And I think that your point about that some of this stuff is in our control. Some of this stuff does have an impact on our overall health, and that there will be another pandemic. There will be another health challenge that comes across the planet. It's going to happen, hopefully not for a long time. But this is how we can keep ourselves resilient through that time. And I don't want us going back to what we were doing before. I want us charting an entirely new course forwards. We need to become aware of what's happening. We are aware of what's happening. It's raised our global consciousness. We're seeing that there's a different option. We're seeing that we weren't tied to the way of doing things as much as we thought that we were. There's a chance for us to rewrite the future. Yeah. And I want us to think about that and make that happen for our children, for ourselves, and for humanity. I think this is a huge adaptive opportunity for us as a species. And we do not want to go backwards. We need to go forwards, and the forwards needs to be different. We had 20% of our population with a mental health challenge. We had skyrocketing rates of burnout. 58% of Canadians, 68% of Americans with overweight or obesity. 85% of us weren't getting enough physical activity to prevent a chronic disease. 25% of us had a diagnosed sleeping disorder. Like, why go backwards? We don't want to go back to normal. We need to come up with a better future. And now the slate's been wiped clean. We can do that. Let's make that happen. And it comes in micro changes, like little tiny things you do on a daily basis with you and your family, change the course of humanity. So yeah, that's my rant.
I mean, that's an important point. Those micro changes are what lead to big changes, right? And there's so much in terms of books that are written about this, and the overarching theme, the mythos of it is always change the smallest things that you can start with. Those will turn into slightly bigger things. Those bigger things will turn into even bigger things, and then before you know it, all of your things are sort of working together. And one of the things, going back to sort of being healthier, that I think scares the average person is sometimes people don't realize, and again, you and I realize this, but it'd be great for, as a physiologist, your perspective on it. you don't need to be an elite athlete to be doing something active and eating the right way in order to have this effect. A lot of it actually comes with this moderate amount of physical activity, which is, what's the definition? 30 minutes of a brisk walk 4 times a week, a moderate diet. I know some people have a preference towards whether they want to be vegetarian or keto, and there's all these things. But I think really at the end of the day, when you look at the research for longevity and for diminishing all-cause mortality, really a lot of it just comes down to moderation. A little bit of exercise, a good moderate diet where you're getting all the healthy, and people know this stuff. It's not like, let's be serious, it's not rocket science. Like, an apple is healthier than a chocolate bar. You don't need to go through 20 years of school to know that. That's pretty simple stuff.
Yeah, I think that, like, literally we could sit back, call our grandmothers, be like, what should we do? Yeah. And they would have 98% of the answers for us, and probably right on the other 2% that we might argue with them on as well. Yeah. So you're right. It's like moderation wins. The human body works great in moderation. We know that if we exercise at moderate intensity for a moderate amount of time, that we have 75% fewer colds and flus. Yeah. If you do extreme exercise, then you get an increase in your risk for colds and flus. Also, if you do no exercise, increased risk. Moderate intensity, moderate volume wins. That moderate intensity and volume is different for everybody. Yeah. Right. So if you're a world-class fitness, you're going to have your moderate is a lot higher than someone that's just starting to get off the couch. But for all of us, we're just looking to be moderate in what we do. We also know that 3, 4, or 5 exercise sessions a week for 45 minutes gives you the lowest mental health burden. That's the lowest risk for depression and anxiety. That's data that came out about a year ago. 3, 4, or 5 workouts a week, 45 minutes each, lowest risk for mental health. And it doesn't matter what you do: gardening, housework, running, jogging, swimming, biking, snow sports, doesn't matter. 45 minutes, 3 times a week, best mental health. And when it comes to exercise and physical health, like cardiovascular fitness and decreased rates of cancer, just think about cancer, for example. 15 minutes of walking a day is enough to decrease the risk of breast cancer and colon cancer 24 to 40%. Doesn't need to be hard, doesn't need to be very much. Cut your risk of cancer almost in half. We know that 60 minutes of exercise a day can cut your risk of cardiovascular disease by 45%. Like, the numbers are astronomical. Tremendous. If there was a drug that was created that did all of that, it would be like the greatest accomplishment in human history. But you can move and go for a walk, get all of the above for free, right? So like, this is possible right now. Moderation wins. And don't worry about how much you need to do or what you like. Just move, go for a walk, play with your family, go to the park, climb up the stairs, do some squats, do some, like, don't sweat about it. Actually do sweat, but like, don't sweat about you know what I'm saying. Yeah. Moderation wins, buddy. Moderation wins. It's easy. Don't get worked up about it. Just do a little bit. The more you do, the better you'll be.
When I do a lot of work with chronic pain patients, and sort of chronic pain is sort of that end stage of everything. Like, you stop moving, you stop eating healthy, you have some type of injury. It all sort of accumulates to the point where you become this chronic pain patient. And the amount of times, like, when people are seeing me and they're like, what's the beginning of this journey going back? And I say to them, like, how often do you move in a day? And it's incredible the amount of people that say, well, I don't really do anything during the day. I just sort of stay at home. I'm on the couch. I'm like, okay, well, I want you to start with 30-minute walk every single day for 4 or 5 days a week. If you could do up to 7 days, great. Like, the more, I'd like you to move for 30 minutes a day, just a nice walk or whatever. And they sort of sit there saying, like, I came to see you so that you could tell me that I have to go walking for 30 minutes a day. And then I always challenge them, and I'm like, listen, just do it for 6 weeks. If in 6 weeks I'm wrong, like, I'm not even going to give you anything else to do. I just want you to start with that. If you don't feel better than you felt today, then I will stop practicing. Like, I'll turn it in. But if you stick with it, I promise you that after that amount of time of just something as simple as 30-minute walk every single day, you will start to feel a little bit better. And honestly, from a purely, case series, all my patients, it always works. It always works. These people feel better. And it's just because, like, you're right. I've said that example, like, I come from an Italian background, and I was like, my mom and my grandparents had it right when they were always talking, a little bit of everything is fine. That's what you always heard growing up. And just a little bit of everything, it's okay. Nothing's going to hurt you. It's interesting because a lot of what we're finding is, like you said, that's probably the truth.
Yeah, and I love the idea of like micro changes, a little bit of everything,
Yeah.
right? So if you think about a 1% improvement today, it's 1% better. 1% of your day is 15 minutes. You do that every single day for a year. If you go 1.01 times, 1.01, you do that over and over and over again, 365 times, you end up improving by a factor of almost 38.
Wow.
It's like a 38-fold improvement in what you're doing. We all know that if you want to get rich, investing, compound interest is the way to do it. 3% per year, every single year, up and down, markets up, markets down, always invest, and you end up being a multimillionaire if you just do that consistently throughout your life, which is why I've started my daughter on that at 9.
Yeah,
right?
exactly.
Like, she's gonna have far more money than I will ever have in my life, and it's gonna really annoy me. But like, whatever. It's like, just, this is simple. The same thing applies to your health. 1% gains consistently over time. You get fitter, faster, healthier, stronger, tougher mentally, happier. Just micro changes over time. When I was in a horrible place in 2012, like I was changing houses, we were moving houses. Judith was finishing Cairo College with you. I was getting ready to go commentate the Olympics for CTV, launching my first book. Ingrid was 2, so I hadn't slept in 2 years. Like, we were exhausted. Like, life was happening. I gave myself every excuse in the book for not doing what I needed to be doing. It was about 8 years ago. And I got really sick. Like, Ingrid got a cold at daycare. I got the cold, but the cold went straight into my heart. I ended up with viral myocarditis, hospitalized.
Wow.
Couldn't move, and decided when I was in the hospital that I was going to register for Ironman, because that's what you do when you're in the cardiac ward. But all I did was, my first workout was literally one day. I walked around the cardiac ward for 15 minutes. I had to go back and sleep for 36 hours. I was so exhausted. But by just being 1% better, eating more berries, eating more veggies, eating less processed foods, doing more meditation, sleeping more, exercising every day, finding some stairs, like, went from the cardiac ward to finishing an Ironman in 12 months. Like, the potential improvement that we all have within us is massive. And we put so many limitations on ourselves. You have a chronic pain patient and you tell them to start walking, they're going to resist you. Like, why? Just open yourself up, go forward, stop the resistance. We're going to move. Like, we just stopped all flights around the world. There's no airplanes in the sky. If you even 6 weeks ago said you couldn't do that, well, now we know that we can. Like, the whole planet is recovering and regenerating as we speak. Like, we can do anything. Humans can do anything. So we just need to make sure that we're moving in a positive direction and not limiting ourselves with preconceived notions about what's possible or what's not possible. So I love your approach.
Yeah, I think that brings it beautifully full circle. Is there anything else you want to add for the listeners, something that you think they should know, or is that sort of...
Honestly, I just love speaking to people. It's so cool that you're building a community of people that are trying to get better, trying to get healthier. You're giving them evidence-based information. It's an honor to be a part of it.
Thank you.
And yeah, the more we can all do like this, and other people listening, we hope that we're inspiring you. We hope that we've given you a chance and permission to let yourself get out there and go do something cool. And if you do so, think of us while you're doing it, and it'll put a little bit of karma away somewhere for us at some point in the future. But just get out there and do something, everyone. Let's just have fun. Let's have a great life. Let's get through this time together. Let's be safe, protect each other, flatten the curve, and we'll be through this as fast as we can. That's Dr. Greg Wells, his book, The Ripple Effect, which is the book that I've read. You have a new one out, though, that I have not read yet. What is that? It's called Rest, Refocus, Recharge. Hang on, I'm going to go get it. 2 seconds. Okay, perfect. It's right here. The old one. Perfect. Rest, Refocus, Recharge, and it is the worst time in history to launch a book. That's okay. Or potentially the best. If you want to get a copy, I would be honored if you did, and that'd be great. Yeah, I mean, I've read The Ripple Effect. You were a professor of mine, and I always found all of your lectures, I don't even have to say it anymore, that they were fascinating, because I'm past that point, so I'm not going to get a better mark. But they were always fascinating. Your book is great. You always provide great advice. People can find out more at, I believe it's wellsperformance.com. Correct. That's my company site. So it's wellsperformance.com. For me personally, for my blogs and books, it's drgregwells.com. So would love to connect with people online. Yeah. Thank you for what you do, Dr. Wells. I think it's very important, and it's good that there's more of us trying to progress humanity forward, I think. Right on. Thank you.